Welcome to another edition of Hub City Times Presents. I'm your host, Peggy Sue Behselich. And today my guest is
Bob Chaloner from the Chief Operating Officer at the Marshfield Medical Center.
And there's a new sign with the Marshfield Medical Center today, Bob. What is it?
There sure is, Peggy Sue, and thank you for inviting me in today. We are officially rebranded as the Marshfield Clinic Sanford Health. As you know, about a year ago, we merged with Sanford Health, and I'm sure we'll be talking about that today.
Might be why we got you on here.
Yeah, absolutely, absolutely.
And I should have said thanks for joining me today, Bob. It's been, we were just trying to figure out, it's been over a year since we've talked.
Yeah, it's always a pleasure, and it's been, when we were trying to figure out, it is over a year, and it certainly has been a busy year.
Yes, it has. And so what's been going on?
So, what hasn't been going on, I should say? Well, the big news, obviously, is that we, as a health system, we joined with Sanford. Sanford is a large health system based out of Sioux Falls in South Dakota. They're almost 4 times the size of Marshfield Clinic. On a combined basis, we're up to about 55 hospitals and 55,000 employees in 45 different hospitals, scattered over 6-7 states across the northern Midwest. Excellent system. We joined for a number of reasons, but mostly because it's a way to continue our mission of providing high-quality health care to rural communities.
And so what are some of the changes that you've seen? Now, before this happened, we had some layoffs happening and things were getting kind of tightening the purse strings kind of thing. What has been happening over the last year?
It's a great question, and I should probably catch up on it was a difficult period the last time we met. We had been through a couple of years of financial difficulty. COVID was not kind to hospitals. That kind of knocked the wind out of our sails financially. Right. We struggled with a computer system implementation that didn't go very well, and so we ended up with really terrific financial difficulty, and up until about 2024 we're losing quite a bit of money. So we did have to go through a tremendous amount of belt tightening. We had to cut almost 500 positions out of our workforce. We had to cut back on certain programs and general savings. This past year has been tremendously successful for us. We are finishing 2025. I haven't seen the final numbers, but with a very healthy bottom line, profitable bottom line, which is a huge turnaround. And it's light years ahead of where we were financially as an organization. So no more cutbacks. We're focused on growth again. We're looking for opportunities to start recruiting again, bring new providers, new doctors, nurse practitioners, other staff into the community. And on top of that, Sanford brings expertise in computer systems, management, and financial stability that will really secure our future moving forward at this point.
And are there any big changes coming up that you can tell us about?
Sure, there's lots of things that we're working on. Last year we were able to launch a number of new clinical programs as a result of our financial improvement. We've brought in some new equipment. We've just gotten funding from a donor actually to start a new program for people who suffer from essential tremors as an example of a new clinical program we've launched. With Sanford, we are going to be changing out our computer system. That will all start this coming year, putting in a system called Epic, which is in most of the major medical centers around the country. That work will start. Won't be visible, we hope, to the public, but it will be a major change in the way we operate with business. We're also working on a number of projects to expand our or improve our facility itself. We're working through a project right now. We're going to be renovating our intensive care units, both the surgical, the medical intensive care unit. Working on an effort to also renovate our neonatal intensive care unit. So beginning an effort to really upgrade the facility, which is an older facility that's needed a bit of an upgrade, a little bit of freshening up, and with Sanford's help now, we are going to be able to start doing that. We have lots of plans for recruiting staff. We've got, this past year was actually very successful as we stabilized financially. That when we're struggling, people weren't so eager to rush to Marshfield and
Right.
get a job with us, so our recruitment was a challenge. This past year, we added 120 doctors to our medical staff, which
Oh,
is
wow.
the best year we've had in many, many years. We're also recruiting to replace, we've had a lot of agency nursing staff in the facility. We've got a number of incentive programs in to recruit new nurses and other staff. We've got a workforce here in Marshfield of almost 4,000 people, so we're constantly recruiting. Anybody that's watching interested in healthcare, please call us. We have lots of needs. We've also are looking at a number of other expansion opportunities. A while ago, we had built a new hospital in Wisconsin Rapids, which we weren't able to open. And that will be opening up. The emergency room part of it will open around March 1st,
Okay.
with inpatient services soon thereafter. So, and numerous other programs that we're working on as well.
So with this financial getting back on the right track, what are you thinking a number of new employees that you're hopefully going to get within this next year?
Well, I can tell you that our physicians, we still have need for probably another 100 to 150 physicians. That's across our entire health system.
Correct.
Those distribute, some here in Marshfield, some in Wausau, Weston, or Eau Claire. Nurses here in Marshfield, we've got a need for about 185 nurses, so
Oh,
a
wow.
huge need still. We've got a number of openings in our radiology technicians, pharmacy. Our pharmacy has been expanding pretty dramatically, so we need pharmacy and pharmacy technicians. Laboratory is also an area that's been growing very quickly for us, so we had lots of need for staff in all of those areas. They're great careers. I mean, one of the other things we're looking at is opportunities to build our own training programs, and we launched a number of those last year. We started a program to train EEG technicians. People
Okay.
are testing, brainwave testing. We have a sleep medicine program with lots of openings. And not a lot of people that have the experience here, so what we're finding is if we create a program, train our own, then they're likely to stay with us. We do the same thing in our X-ray. We've got training programs in new nurse program and training program nursing, critical care nursing, that we're taking graduates right out of nursing school and training them up to be critical care nurses. We graduated about 25, 30 of those last year. Who are now working in our critical care unit. So very excited about some of these training programs.
So if somebody that's watching would want to check out one of these programs and see, how do they find out more information about the program?
The best way would probably be just get on our website, and all of our vacancies or job openings are posted on there. Look at that. There are people often think, oh, if I'm going to go to work at a hospital or a clinic, I need to be a nurse or a doctor. I mean, what's always fascinated me about this field is a hospital's like a little city, and you think about all the departments that make it run. And yes, we have doctors, we have neurosurgeons, we have open heart surgeons, we have people that have lots and lots of training, but we also have a lot of entry-level jobs for people that might want to get a foot in the door in healthcare. Anywhere from, we operate our own mini restaurant with our food service department. We've got clerical jobs that are really entry-level, people that are checking patients in at the front desks, and those are
Right.
jobs that we can train. Don't need a college degree. We do need a high school degree or a high school diploma, but lots of opportunity and everything in between, from technical jobs to finance jobs to people working in our laboratory and doing research, to nurses, doctors, and technicians, the type of jobs that we typically think of. But many, many opportunities out there, so would really encourage people to take a look. And healthcare is one of those things that people worry about. One of the things I like about healthcare, it's not just the fact that we're providing healthcare to the community, but we are providing lots of good employment to a lot of people in the
Correct.
community. We have people that are, this is, good, stable jobs, and they're not likely to be replaced by AI. We need human beings providing health care. Lots of ways to get in, even if you're right out of high school and just want to try working as somebody at one of our front desks, checking people in, get a feel for it. That's how I got started. I was in college and ended up as a EKG tech part-time while I was going to college, and that was my first chance to work in a hospital. I found it really interesting, and little by little acquired the experience and the degrees that it would require to become an administrator. So I really would encourage people to consider healthcare as a job. And I've had a couple people. I have a young relative actually. I was trying to figure out what he wanted to do with his life, and I said, "Why don't you come work in healthcare?" And he said, "I don't like blood. I don't want to deal with that sort of thing." He said, "There's lots of jobs you don't never touch blood. I'm
Right.
an administrator. I'm sitting in and maybe bloody paperwork, but that's not all I'm dealing
That doesn't
with."
count.
No, it doesn't. So there's a vast number of opportunities, and here in Marshfield, we're very proud of the fact that we employ so much of the community, and the jobs they offer good wages and good benefits, and you'll never need to worry about being employed if you come work with us. So.
Well, and I think you brought up the point that, okay, we know there's doctors, we know there's nurses, they're very valuable, but so are all the other people around.
Yeah.
We couldn't have our hospital running without those people, including the person cleaning the floors.
Oh, absolutely.
I mean, they're all important jobs.
They're all important, and the doctors, the neurosurgeon that I'm talking about can't operate in the OR without somebody scheduling their cases, somebody keeping track of all of the paperwork, the nurses that are scrubbing in with them, the technicians that are making sure the room is ready, the orderlies and the housekeeping workers cleaning the room, and the central service techs that are cleaning all the instrumentation, which is actually a very specialized job.
Correct.
And require a tremendous amount of support. And you think about if you've ever been a patient, the number of people that you interact with at every step along the way with that visit to a hospital or a clinic. So all of those jobs are important, and it's, the expression, it takes a village. It really does take a village to provide health care.
And so Marshfield alone, I'm going to put you on the spot.
Yep.
Marshfield alone system, how many employees are there for the Marshfield location?
So here in Marshfield, we have 4,000 employees.
Okay.
In Marshfield Clinic, the region of Sanford, we have about 11,000 employees. That's all employees. And then Sanford, the system that we're now a part of, employs 55,000 people. So healthcare is really an important employer in many, many communities.
Yeah.
We are the largest employer in many small communities in particular. And if you look at workforce across many states, healthcare is a major driver of employment. So, and it's the other things around healthcare also, the pharmacies, the home care agencies, the nursing homes that are all, it's not just the hospital, it's a whole ecosystem of other businesses that are surrounding healthcare too. So, and I think, like I said, I've always loved the fact that not only are we providing healthcare, but we're providing good jobs for people also.
What I'm finding fun in this whole conversation, like we said, it's been over a year since we've talked. But you did sit here and say, we're turning this around.
Oh, absolutely.
And it's exciting to watch. After our talk, I felt better about the position we were in because I live here in this community. I'm part of this community, and I was scared.
Yeah.
But after talking to you, you said, we're going to turn this around. And it's pretty cool. It's turning around.
It's turned around, and it is getting stronger and stronger. And you're absolutely right. I joined almost 3 years ago. I came to the community, and we were really struggling. I mean, it wasn't good financially.
Yeah.
And the future did look a little bit uncertain. I was confident because I've been through it before. I've been through healthcare turnarounds. I also know that this region needs this healthcare. And
Correct.
The community here, Peggy Sue, I have to say, has been one of the greatest joys for living and working here, because the support that you all have shown us and that, anxiety that you've felt is, I think, kind of one of the things that helped motivate us. And you've helped us by showing us where we could improve. You've helped us by making donations. You've helped us by just being our cheerleader when we needed it. I had no doubt that we would turn it around, because the things that were broken were fixable. The fact that our computer system wasn't working and we weren't sending out bills.
We were okay with that.
No, I know. I always joke, because it was, when I first got here, in my job, as the administrator, we're always going to get complaints about billing. Nobody likes it. Hospital bills are awful. They never understand them. They're high, and I'm just used to getting complaints about billing, and the insurance billing process is very complicated. But for first 6 months or so I was here, and I realized I hadn't gotten a single complaint about billing, and there was a reason about that. So I am getting the complaints about billing, which is good now, because we are getting the bills out. But we need to do that, because that's the way we get the revenue in to keep the wheels on and keep the hospital supported, and so we've been able to fix that, and we still have opportunity to fix it even more, so that there's still revenue that we can get. We've been able to reduce some costs that we didn't have. We've been able to negotiate contracts that we were overpaying for. We had some facilities that were underutilized that we've been able to cut. So that has really created, all of those things were things that we could do. We were able to refinance and lower our interest rates. And now with Sanford, they're allowing us, because of their size, to tap into new purchasing programs. What they're going to help us, as I mentioned, put in this new computer system that will strengthen our billing and our revenue cycle even more. If a doctor doesn't document correctly, we miss certain codes, that may mean we aren't able to bill as much as we were able to previously, or able to legitimately. The Sanford has worked that out and will teach us how to do a lot of those things better. So, and that's why I'm even more convinced today than I was last time we met, because we've made this big turnaround. We're seeing the financial results. And I know that we still have room to keep improving. So
I just don't know how our viewers, including myself, feel about this billing being better.
Oh, I know, that's probably not. Yeah, we will always bill legitimately, and we'll bill according to the insurance
I understand that,
yeah.
but it wasn't a bad time for us when it wasn't
Yeah,
getting
no,
mailed.
no, you're right.
I understand you were in a bad position, but that wasn't my problem.
Yeah, exactly. Yeah, no, you're absolutely. I can understand that. It's not sustainable long term. It's kind of like long term. We need to figure out, just like every other business in the community, how to bill. But it's been remarkable, and I have to say the community support has been overwhelming, really motivating for all of us. And it's interesting too, because this community was so striking. I came from the New York area, and worked with a lot of other colleagues in the hospital, but it wasn't often that our workers were scattered throughout the New York area. Here, our workers are your husbands and your wives and your children and your relatives, and so our ability to provide good health care is very, very personal in this community, and I've heard that from a lot of people. We're not treating strangers, we're treating our neighbors and family members. And we're also in a situation where the employment that we provide matters to an awful lot of families in this community, and I think that's been important. So that support in the community has been just truly amazing. And our staff have been unbelievable at every single level, and it's been rough. I mean, because we have had to make cuts, and we have had to pull back on certain things. For a while, we weren't able to pay into people's retirement plans, and we've fixed all of that. But people have stayed with us, and it's just the dedication that the team has is amazing. That's the other thing I like working in hospitals. I mean, you don't need to just go out onto a floor and see a nurse and interacting with a patient, or someone helping a family member who's struggling at the end of life, and it's very rewarding, actually. So
I think you nailed it, though. Our community is a family.
Yeah.
And you have that at the clinic and the hospital also. It's that family. You're caring for those people. You don't feel like a number. When I've had loved ones up at this hospital, it wasn't you're a number.
Right.
They cared. They showed they cared, depending what's going on.
And, that is, I think, one of the things that will not only make us different, but ensure our survival going forward, is the fact that our people do care. And that's been a challenge for us a little bit. We've had, COVID scared a lot of people out of healthcare, and a lot of baby boomers, especially, who were like, okay, I've had enough. I'm out, and retired. So we had a lot of jobs open up because of retirements of so many of the baby boomers, and now we've got a lot of vacancies, and we're filling those, a lot of them still, with agency staff, people who are coming in as short-term workers, and they're good. They've got the technical skills, but they don't have that connection to the community the same way, which is probably our biggest area of focus for this coming year, is to really hire more people. And that's why I really want to encourage local people that are considering careers to consider healthcare, because people who live in the community, I think, are going to provide that level of caring that's going to make the difference for us.
And it does. It makes you stand out. If you have somebody that truly cares, and we were discussing it earlier, it's the New York mentality. No offense to New York, but
right.
How you doing? And you keep walking.
Yeah, exactly.
But here, like we said, how are you doing? And the person stops and listens.
No, exactly. And I've seen that so many times. I mean, you see somebody coming through our front doors, and they're struggling, whatever way. It's a big campus too. How do you navigate through it?
Yes.
And, what we really encourage our staff is, we don't want somebody, if somebody asks you directions, don't just point down the hallway. Get up and walk with them, help them. And we see that happening naturally in this community. People really do want to help, and it's always interesting. I always worry a little bit about the privacy issues, because everybody knows each other too. And
Right.
So, hey, hey, Peggy Sue, I see you're at the hospital. And Peggy Sue maybe doesn't want the world to know she's at the hospital, but that's probably part of the challenge of being in a small town. So.
Yeah. But it is what it is. And
so what makes it special, I think.
Exactly.
Yeah.
And the people are going to care. What do you mean, Peggy Sue, you're in the hospital? Are you okay? Is everything okay?
Yeah, absolutely. And it's other things that this community has done, like one of the Hope Lodge, and I heard the story of the Hope Lodge, which was the facility that the American Cancer Society ran that shut down during COVID.
Correct.
And the community raised the funds and totally renovated it, and now it's Cattail's Place, which we operate for families who are here for, a family member who's got cancer, or a patient who's got cancer, and they're here for an extended stay. And Hope Lodge is just beautiful. It's like a first-class hotel over there, the way it looks. And that was, this community came together and made that possible for our patients. And we have so many examples of that. Our NICU campaign, which I mentioned, and getting the NICU renovated. We've had so many donors, and we're closing in on we have a $12 million goal to get that unit renovated, and I think we're up there at this point. We're getting very close, so a lot more to come on that.
Somebody still wanted to donate. Is there room to donate for that?
Oh, absolutely. Yeah, absolutely. We always have room to donate. And our foundation, led here locally by Terry Wilczek and her team, are phenomenal. And again, if you go on our website, if you want to donate. In fact, I'd recommend everybody sign up for a job and donate to us. That'd be a great
homework
thing to
for
do.
Today.
Yeah, exactly right. Exactly right. So.
Let's see. I might have some hours that I'm not working or sleeping.
Yeah, exactly right. In between all your other things. Exactly right. So, yeah. So, no, it's just been the support has been wonderful, and we still have our challenges. I mean, one the things we're working through, as I said, staffing is probably, and that's not unique to Marshfield. I mean, sometimes because we're the only hospital in town, people think our problems are unique. They really aren't. The hospitals across the country are struggling. Right. We've got a lot of baby boomers who are aging and starting to use healthcare more than ever. At the same time, the workforce has shrunk in healthcare, so it's putting a lot of stress on healthcare. But we are working through that, and as I mentioned, these training programs that we're developing will be the way I think we're going to work our way through some of that. We have a lot of work to do yet. We're integrating ourselves with Sanford, so the logo change you talked about at the beginning of the show is One very visible, we'll be rebranding ourselves. We're still calling ourselves Marshfield Clinic. We're Marshfield Clinic, a region of Sanford Health. And that's important to us because Marshfield Clinic is a 100-year-old history in this community. And Marshfield Clinic is, frankly, it's what got me here from New York, because I've always heard of the Marshfield Clinic. It's got quite a name. So that was important that we keep that, and our friends at Sanford felt that was important also. But we have a lot of work we're doing with Sanford. That's good work, and we're learning with them. We've got resources from them now that we can bring here. The computer system change we're looking forward to, because it will strengthen us even more.
He is.
Yeah, it'll still, this time we're not going to break the billing. But that is that's a change that we're very hopeful about. And we have a lot of new clinical programs we're working our way through as well.
I think it's getting very close to where we have to wrap this up. But hopefully we'll talk again before a year.
Yep.
And what is the biggest challenge you're hoping that you can tell us you conquered the next time we meet?
That's a good one. I think I am hoping if it's toward the end of next year that I will be able to tell you that we have recruited even more doctors, nurses, and other staff, and that's really the biggest need that we have at this point. We've got the patients, we've got the facilities, we've got a really great partner to work with now. We just need the people to help us make that happen. And I think we're putting in place the incentive programs, the compensation programs, the training programs, but we just need to get more people. So I'm hoping by end of next year I can say we've had our best recruitment year ever.
This year.
This year. Yeah,
this year. We'll meet.
2026.
Yeah,
exactly.
We'll meet
in the fall.
In the fall.
Great.
And hopefully you'll be able to tell us you've hired, what's that number?
I'm
putting you on the spot.
It's probably about 500 people across our system that we need to hire at this point. Absolutely.
So we're going to remember 500.
Yeah, exactly.
And we're going to set a date in November.
Yep.
That we'll meet.
Yeah, absolutely, and celebrate it. So
perfect.
Exactly. All right.
Perfect. Well, thank you for joining.
Peggy Sue, thank you so much, and it's always a pleasure to meet with you, and thank you for all your support.
Oh, thank you.
Yeah.
And thank you for joining us for another edition of Hub City Times Presents.